Hello, we're from Parafricta, and in this virtual presentation to you or your team of nurses and carers, we'd like to address preventing and treating pressure ulcers in your patients and people in your care, in this case particularly on heels, feet and ankles. One strategy you may have encountered is to use offloading, immobilizing boots. Let's consider some of the situations where such interventions may not be the ideal answer.
Do you have patients who want to use their heels to push themselves up in bed and develop non-blanching erythema or other early signs of a pressure ulcer? Do you have patients who find it difficult to reposition without their heels being unavoidably dragged on the support surface? Do you have patients who are very restless, can't keep their legs still, or may have involuntary spasms which would cause them to rub their heels on the bed? Do you have patients who, despite your best efforts to get them to use an offloading or mobilizing boot, simply won't, or find it too uncomfortable? Lastly, do you have patients who are at very high risk of pressure ulcers, for example diabetics, people with very fragile skin, or who are nearing the end of life? Well, we'd like to show you that a better solution to some of these issues can be Parafricta low-friction fabric booties. Parafricta with a unique low-friction fabric which is designed to defend skin from the damaging effects of friction and associated shear. Now, of course, many people understandably think that the primary cause of pressure ulcers is pressure or compression. But we now know that in situations where people are moving their feet, the friction and the associated shear element may be as big a contributor to the breakdown of tissue and to the eventual formation of a pressure ulcer. The ideal time to address pressure ulcer formation when friction and shear is involved is before it starts. That means getting an intervention such as a pair of Parafricta booties onto the foot as soon as the risk is identified. To that end, we have developed prevention pathways which suggest ways in which Parafricta booties can be introduced into routine pressure ulcer prevention on the feet and in other vulnerable areas with our other products. The booties can also be used when an early stage pressure ulcer has already developed. A category 1 pressure ulcer is characterized not just by reddening, non-blanching erythema, but also by other signs including changes in skin texture, heat and edema, which are manifestations of what's going on underneath the skin surface. In several studies, Parafricta booties have been shown to completely reverse category 1 pressure ulcer development when they are worn over a period of a couple of weeks. They can also be used to aid in the healing of more advanced pressure ulcers, including category 2 pressure ulcers. Again, if the patient is particularly agitated or unable to or unwilling to use an offloading, immobilizing boot, an option is to dress the pressure ulcer, as of course you would do anyway, and then put a pair of Parafricta booties onto their feet. You might also choose to use some elevating mechanisms such as a pillow or a wedge to help reduce the pressure element as well as the friction and shear element. What otherwise often happens is that a dressing will be rucked up or completely sloughed off by the same rubbing action which was the underlying cause of the pressure ulcer in the first place. Therefore, retaining that dressing with a Parafricta bootie is an important added benefit of the combination. The Parafricta bootie is an ideal way of comfortably and easily preventing pressure ulcer formation or for managing early stage pressure ulcers as part of your total pressure ulcer prevention and treatment strategy. The booties come in a range of sizes, so it's possible to select the ideal size for your patients and people in your care. They're easy to secure and don't slip off people who are agitated or restless. They have a non-slip sole. This is important because patients would generally be in bed when they're at high risk of getting a pressure ulcer on their heels, but may wish to get out of bed and move to a chair, and that's to ensure there are no risk of slips and falls. There are 2 reusable models of bootie. The most used is the slip-on bootie, which is easy to put onto the patient and is very comfortable and unobtrusive. There is also the Velcro closure model, which is a much larger bootie that you can open up and just slip the foot in. That may be useful for patients who are at risk of swollen ankles or who find it difficult to get the slip-on booties on. They're also better where more protection is needed higher up the leg, particularly over the ankle bone, because in this case the Parafricta low-friction fabric covers the malleolus. From the perspective of the patient, they're very comfortable. They're lightweight, they're breathable, they feel cool against the skin. It's really a very unobtrusive way just to slip something onto the patient's foot and leave them to do just as they would do normally in bed. They're not going to be conscious of having a bootie on it in the way they might be if they were in a heavy offloading immobilizing boot. They're also very easy to slip off because, of course, it is important to regularly inspect the skin. So, unlike for example when using a prophylactic dressing, which would require you to take it off to have a look underneath, you can just slip the bootie off and ensure that everything is looking and feeling alright. Two versions of the bootie, the slip-on and the Velcro closure, are reusable, and that means they present tremendous value for money. They can be washed in a domestic washing machine or in a commercial laundry and tumble dried. Typically, one would expect them to be washed and reused between 3 and 20 times, which means that compared, for example, to using multiple prophylactic dressings, there really is no comparison. They work out much cheaper per patient episode. But we all realise that in hospitals it may be impractical to wash and reuse the booties. Therefore, we offer another version for single patient use, which is in a different style we call the Easy On style. As you can see, this has the best features of the two reusable styles. It does go further up the ankle. It has a stretchy and wide opening, which makes it easier to get on and off. It's considerably cheaper per item, but of course, it can't be washed and reused. Overall, the cost benefit of using Parafricta booties for preventing pressure ulcers is overwhelming. If you look at the analysis which was done for the review of these by NICE, both in 2014 and refreshed in 2021, it's what you might call a no-brainer that preventing a pressure ulcer is well worth the cost of a Parafricta bootie, considering all of the costs which will be involved if a patient gets a pressure ulcer, such as extra days in a hospital bed, dressings, nursing time and other interventions. This is nothing still as compared to the cost of a pressure ulcer that otherwise progresses to a more serious Category 3 or 4 ulcer, has other comorbidities and can even be life-threatening. Parafricta reusable booties have been used at St Helens and Knowsley NHS Trust for almost 10 years. There, the booties are given routinely to patients assessed as being at risk of pressure ulcers, at the same time as a pressure-relieving mattress. The Trust reports the lowest instance of hospital-acquired pressure ulcers in England. Net savings to the Trust, largely because of reduced hospital stays, have been estimated to be £150,000 per year.
So in summary, Parafricta booties are an ideal solution for preventing and aiding the treatment of early-stage pressure ulcers, particularly in patients for whom using an offloading, immobilising boot is not well tolerated. Parafricta booties are an easy, comfortable and cost-effective way of preventing and treating pressure ulcers on the feet. They are more acceptable to patients and convenient for nurses and carers.
If you need more information on how to obtain our booties for your patients, please check out our website, parafricta.com. You can email us at info@parafricta.com or call 01869 226 566. Other information on how to use the booties is in our training videos and user guides, which are available online.